So the benefits are that we have good information that it helps if you do get exposed, one, not get infected, and if you do get infected, have less serious disease. And this also protects those around us who, one, may not be able to get it because, for example, they have a low immune system, or just because, for example, your grandparents, your parents, you want to protect your entire family. So those are all fantastic reasons to get it. In terms of how kids react to COVID-19, the issue is that we do not have a crystal ball, so it is not completely risk-free for children. Although the majority of them can have lower risk symptoms than adults, especially elderly, and a lot of them even are asymptomatic, there are many children that get very sick, and we cannot predict who those children will be. So for example, we know that over 3,000 children in the United States have come down with a very rough form called the MIS-C. It's a complication of COVID-19, and that can be very serious and dangerous for children. And over 300 children in the United States have actually died from COVID-19. And when you come into my office, I have no way of predicting that your child is going to be one of those, and as a parent myself, I would just never want to take that risk. So the best way to protect all of our children is to get everyone vaccinated. Great question, and it's a little bit of what your family dynamic looks like. So for example, I'm a mother of two. Both my children are not adolescents, so they will not receive this vaccination. So I am still going to stay very judicious in how I approach play dates, for example. So maybe in my situation, we would still have outdoor play dates because we know that the CDC talks about being outdoors decreases your risk. Also, it's still important to think about what your bubble is. So for your adolescents that are really eager to see their friends, that's fantastic, and we want them to be able to do that. But maybe still limit that, to a few families that you all feel comfortable and you know what your risk factors are. So this is the key in communication and the idea of social responsibility, of being aware of yourself, your family, the risk factors that you have, and also the risk factors that your community is having in terms of cases. And finally, the risk factors of those you want to interact with. So the majority of the side effects are going to be headache, fatigue, and then also muscle pain, particularly at the site where the shot is given. There are some reports of things like a fever, some nausea, but all of these things can be supported at home with the same things that you use on a day-to-day basis. So for example, rest, good fluids, doing Tylenol, ibuprofen, all of those things can help with all of these symptoms. When we're talking about testing and safety of vaccine, over 150 million people in the United States have received the COVID vaccine, and there have been very, very few serious side effects. And so again, we have this really large pool to know that this vaccine is safe and effective. We don't know what the long-term side effects are. That is the bottom line. But what we can say is this: we have a history of very rigorous studies of vaccines that have kept millions of children safe from diseases that could otherwise cause great disease and even death. Okay? This vaccine was created through that exact same process. We also know that we have a good amount of data for adults that we've been following over time with this vaccine rollout for adults. The ages of 12 to 16, which is the next wave of vaccines, are going to follow that same rigorous study and being very judicious about how we measure the side effects and what to do with them when we find them. Herd immunity is a really important concept for all of our community to understand. So it's the idea that, let's say you put 50 children in a room, right? So if all of them are vaccinated, the likelihood that this virus is really going to be able to hop from one person to another is very low. Not completely zero, and that's important to know, but definitely very low. If half of them, though, do not have the vaccine, even a person who's vaccinated, you can imagine that they're getting bombarded from all sides, possibly, by people who are experiencing the virus. And at some point, it might break through what we call that vaccine shield and really infect that person. And so even though we encourage people to maintain social distancing and to do all these great measures, vaccinating is one of the most important ways to keep us all safe. So I have two amazing children, one who just turned 8, one who is 2, and if they were of age, I would definitely vaccinate them, and we will be some of the first in line, hopefully in the fall, to get them vaccinated in order both to help them get back to their sense of normalcy, but also to protect them, because this is not something that we should take lightly. We should protect our children with whatever we have.